So today what we're gonna do is go over electric stim modality. So you might see this.
Does that mean I get electrocuted?
We could do, I don't know, have you ever seen that challenge where they put it up to their hand and they're trying to drink water and they're like, now we can do that today. So
I don't want to do that.
So we're gonna put it to one side of her neck and she's gonna be like, and then she's gonna try to kiss me. St. Patty's Day, right?
Okay, so both of us have muscle stim in our office. Most chiropractors you guys come across will probably have it.
Right.
So why would we need to use muscle stim, Tri?
Okay, so one reason would be pain. Now we would say, what's the difference between an acute injury and a chronic injury?
What does acute mean?
Typically, like right now, it's recent, like it's acute.
Like you're a cute guy? Mm-hmm.
Yeah.
Okay.
That's what my mom told me.
Okay.
Anyway, so acute. So you sprain your ankle, you want to put some type of electric stim on there to decrease the pain. We can set it on there that has different settings. They've gotten drastically better with the technology over the past, say, 5-10 years, where you can have different settings in there to have different frequencies with built into the actual machine to really focus on inflammation or pain or stimulate healing. So there's different settings that we can do to accomplish that. Or you have the fun chronic issue. So, I don't know, say like our parents that, you know, my dad, he's a truck driver. He's sitting a lot and he has chronic hip and lower back pain. It's been going on for years. He's too darn stubborn to do much about it. So,
James, he just called you out.
love you. But yes, so we would do both for those. Maybe a different setting. That's the beautiful thing about the cool technology, but feels for the most part the same.
Okay. The thing that patients always ask though is, well, why do I have to pay for that? I have a TENS unit at home.
Sure.
What's the difference in a TENS unit and this thing? Is it just because this is like really, really big?
Possibly.
That is not true.
It's a cooler machine. So that's where we're talking about your settings. Like they are getting better with the home therapy. And the cool thing is back, I don't know, say 5 years ago, the TENS unit, you would spend $200, $300, $400 for one of those crazy things. Now you can get it on Amazon for like $50. So I'm not saying it's not a bad thing to have, but you have to break down what the TENS unit even means. So it's transcutaneous electric muscle stimulation.
Okay, all of those words are just mind-boggling.
All right, so we're gonna get into a little neurology segment. Here we go.
Okay, you go on tangents. Please don't do that.
So you gotta understand why you're doing this. Like, what's the validity of me doing this versus my TENS?
Before Tri goes on his crazy tangent? What I say to patients is a TENS unit is more superficial and muscle stim is able to go deeper and create more of that healing and decrease the spasms and all that kind of stuff.
So you're not watching this podcast to just get the very superficial TENS unit aspect.
I'm just trying to help you guys understand
to
where Tri is going a little too crazy.
So we're down the rabbit hole. Here we go. Now, think of your nerves. So you have, for the most part, two types of nerves. You have a large myelinated fiber and a small unmyelinated fiber. So myelination means it has like a covering over it. Makes it go faster. It's typically like sharp shooting type pains. And then you have the unmyelinated fiber, which deals with dull, achy pain. I'm gonna keep it simple. So when you have an injury, what naturally will happen is the large myelinated fibers, when they're working right, they inhibit the small unmyelinated fibers, okay? Now, if you get injured, you mess up the muscle spindles, the tissue nerves. What it does is now these aren't working right, so they're no longer able to stop the unmyelinated fibers, and so that's where the dull, achy pain comes into effect. What a TENS unit does is it stimulates those muscles and joints, little signals to the brain, so the large myelinated fibers, to now it dampens or inhibits the unmyelinated fibers. So when you have a TENS unit on there, all it does is modulate pain when it's on. Okay, so you're not really fixing anything. It's just a nice pain reliever at the time.
Thanks, Trey.
That's why this is more important, because it's actually doing something on a deeper level.
So it'd be like the difference between biofreeze and something that actually goes into your tissues and like creates healing.
Precisely.
Okay, yeah.
You ready to get hooked up?
Yeah, let's do it.
Okie doke. So
What are you putting on me?
these are called electrodes. So I have 2 leads that separate into 4 wires where you put 4 pads, these electrodes that just stick to the affected area we would like to work. So it's not hard. You just kind of stick them on there. There's specific places that we would like. She's kind of dealing with a little upper back, lower neck issues that we kind of want to address. So I put them as an X pattern. One here, one on the other side of the mid back, and then on the lower part of the neck, and then the other side. So that X marks the spot where I want to get her affected area to improve.
Which is what y'all need to do. If you have TENS units at home, that's how you should set up your
X marks the spot,
too.
not, hey, I'm going to put it where it only hurts at.
Yeah.
Okay. And the wider you go, the deeper it's going to go. So the closer it is, the arc is very small and it's more in the skin type area, and it's probably actually going to hurt a little bit. So widen it out. Little nugget there.
Great.
All right, here we go. Time to do that challenge, right?
No.
Come see. You want to see how I can?
Try.
This is payback for all that stuff you.
What? I do nothing to you but love you.
I love you too, with electricity. Do you feel it yet?
No.
Not yet.
I don't know that he knows how to work. Oh,
Probably
there
not.
it is.
This isn't my machine. All right. Tell me when. I'm keeping going.
You can stop now.
Okay. Push play. And then, so we had it on a setting for an interferential. So this one is really trying to help drive some healing and anti-inflammatory type processes in this area. So this setting is going to cause it to contract and then relax. Sometimes when you have a super injured area, like a broken bone or something like that, we'll do a microcurrent. So what it does is it's not as intense. You won't really feel it. It kind of maybe feels a tingle, because if it's fractured in there, I don't want to cause any movement in the fracture, but I still want to. Yeah, that wouldn't feel very good.
Yeah.
And so we're just trying to stimulate healing. That's what microcurrent is designed for.
So the typical time that we would keep a patient on muscle stim would be about 10 minutes, right?
10, 15.
Yep. And the reason that we would want to prescribe or recommend that for patients would be because of pain,
Decrease inflammation.
decrease inflammation.
And then also decrease spasm. So if you have an area that's very tight on you, sometimes if it's so stiff in there, I like to have this done before I adjust, or have it done before they go back and exercise. So that for the stiffness part. Now, sometimes, because I like to start exercise pretty early, I'm not as sympathetic, I guess, as Rachel. Like, I get you moving and you got to get moving. So sometimes the exercise will flare you up. I will do this after the exercise because it's a little inflamed and I don't let you leave inflamed.
Well, and also, a couple of months ago, we talked about the flexion distraction.
Yeah.
I love doing muscle stim after that because it can, like we talked about then, it can stretch out those muscles and it can really irritate the lower back. So we just want to make sure that, like you said, people don't leave feeling crummy. You should never be using a TENS unit or muscle stim if you have a pacemaker. Please do not do that. That would not be good.
That should not be a challenge.
Yeah. If you've got metal in your body, if you have metal in your body,
Dark humor.
You should not be using electricity over the metal. If somebody tries to do that, say, please do not do that. What else?
Typically,
Age.
like cancers, tumors, open wounds, like you typically don't want to do that over this area either.
And then ages.
Yeah. You don't want to strap, a little newborn on this bad boy?
No.
Why not?
Well, first off, that they probably don't need that.
You're right, I guess so. Yeah.
But it doesn't matter how old a person is, as far as like if they're too old.
So top end, you're okay.
Yeah.
Okay. How about young part?
I'm trying to think of like the youngest person.
I've probably done maybe a 10-year-old, honestly, so that they can actually have a conversation with you of like, how are they feeling?
Yeah.
What does it feel like? This is what it's going to feel like. It's going to feel weird, kind of like move the muscles around and kind of like prickly type stuff. So anything younger than that, I've seen the communication be a problem.
Kids seem to think that me just doing that is like, that hurts.
Yeah. So I guess that's enough. Electric stim, pretty simple. It's a great modality for when you're in pain or spasm or just sometimes wanting to feel good. Like patients sometimes are like, I love you, Dr. Myers, but man, that stim is fantastic. Can I do that? And I'm like,
Yeah.
fine, you can go do the stim. I know that's why you're really here.
So we want to do the muscle stim usually in the beginning of treatment, and then try to get away from that and really start honing in on exercises and movement and that sort of thing. So definitely, if you're going to a chiropractor, maybe ask if they have that available, because it will it will help you kind of progress in your treatment.
Speeds things up.
Yeah. So I want to encourage you guys to own your health and wellness.
Yep. Like, subscribe, comment below, and we'll see you next time.
Happy St. Patty's Day. Enjoy that cabbage.